Hey everyone, Paul from Ortho Eval Pal. Today I want to talk about the classic signs of hip arthritis. Now this is something that so many people have and I get so many questions about, how do I know if my hip pain is hip arthritis? And so what I'm going to do first though is talk about what hip arthritis is so you have a better understanding of why these symptoms give you trouble and what it looks like, okay? So I'm just going to come in close here and I'm going to show you this hip. You have a ball and socket type of configuration. This is the pelvis. There is a socket that's part of the pelvis here, and then you've got this nice ball that sits in there. Now when you're young, you have this nice smooth cartilage that protects both surfaces. They ride on each other really, really well, okay? As we get older, those surfaces start to break down. They start to get roughened a little bit, and these parts of the joint here start to develop a spur that will come out this way, and the ball will become roughened and also develop a spur this way, so that whenever you bring that hip forward, those spurs can hit right in here. Or if you rotate the leg, you can see how that would cause some irritation inside this part of the joint right here, okay? So that is kind of what hip arthritis is. It's a wear and tear type of issue, no different than the tires in your car breaking down over time. Your hip will break down. Some people will have a little earlier breakdown of that hip if there's some sort of deformity around the hip joint that causes it to not work as naturally as possible. So what I want to do is I want to bring in somebody who actually has hip arthritis, show you what these classic signs are like, and we'll go from there. So this is Beth. Beth, I'm going to have you sit right here. Beth has moderate to severe hip arthritis in her left hip joint, and it is just progressively getting worse. She's really needs a hip replacement, and that should be coming anytime soon. So the first classic sign that you'll see is when you're trying to put your shoes and socks on, it's difficult to reach for that foot to get to it, okay? So Beth has actually learned to compensate because it's too painful for that leg to come straight up. So let's see what you do to typically take your sock off. Notice how she grabbed her leg to bring it onto the other side. Now we'll put that sock back on. And see how she had to put that knee out there because it's too pinchy to do it this way. So I'm going to ask you to try to reach like this toward your foot just to demonstrate how high you get. And it's right about there, okay? And it's pretty uncomfortable. Yes. And so where is your pain mostly?
Right in through here and through my groin.
Okay, so that's the most common spot to have discomfort is in the groin area. Some people can, when it's real severe, can have pain that migrates through the hip. So imagine these two fingers coming together at a point deep in your hip joint, and that can migrate into that area. We've even seen people who have hip joint arthritis that have back pain, okay? So it's very important that we identify if this is a hip problem or a back problem. Now, let's talk about this pain also. It's not uncommon to have discomfort from the hip migrating down the front of the thigh all the way to the knee. But hip arthritis does not pass the knee joint. Some people will have this aching in the leg, pain in the thigh, and even aching in the knee. And so that is, typically when arthritis gets really bad in the hip, that's going to start to act up like that. The next thing that we've noticed is that when people are sitting for a long period of time, they have a hard time taking their first couple steps when they get up. So I'm going to have Beth take a few steps from here to this side of the table, and you'll kind of see what happens here. I'm going to step out. And you can see she has a hard time bearing weight on that leg. And I'm going to have you turn around and we're going to head back. And after a few steps, maybe a dozen steps, it starts to get a little bit better and a little less painful. So that would be a classic walk where they have a hard time allowing the leg to go behind them and they get this discomfort in the hip. So I'm going to have you lie right down on your back. When it comes to range of motion, there are three common motions that are real difficult to gain when you have hip arthritis. And the first one is hip flexion. So what I'm going to do is I'm going to take her through the motion and I'm going to keep the leg straight with the shoulder and bring it up. And I'm not going to turn the leg in or out this way. I'm just going to go straight up, and you're going to tell me when you start to have discomfort with that.
Right there.
Okay. So that's classic, and that's pretty limited, okay? That's about 90 degrees normal. She should be able to bring that leg right up to her belly, okay, and have nice hip flexion in there, but she does not have that. Then when we do that in combination with internal rotation, which is taking the bottom part of the leg and bringing it out this way, we don't get very far. We have about 10 degrees of motion. It gets really pinchy in there, and I'm not going to push her any harder than that. And then the last motion that we look at is hip adduction. So I lift the good leg, okay, and then I take the bad leg and I bring it underneath like this, and that caused a little pinch in the groin. She's at about 10 degrees right there. We should get more than that, okay? And what will happen is the hip will bind up and the body will start to shift as you move the leg in like that, but usually you're going to be more limited by pain. Now some people can have discomfort with the leg coming out this way also, but it's usually more limited going inward. All right. The next thing I want to talk about is pain with a straight leg raise test. And there's a reason for this, okay? Now you think that, you know, we're not putting the hip in a pinch position, so it really shouldn't hurt. And this is really just more muscular. So she's going to hold her leg there at about 45 degrees, and I want you to hold it nice and tight. I'm going to try to push down, and it gets uncomfortable and hard to hold. And the reason for that is that when her hip flexor muscle is pulling on her leg, it is driving the femoral head into the socket and striking those arthritic joints together and causing more of a pinch inside that joint. So that's why people who have hip arthritis have difficult time lifting that leg straight up in the air, and that'll cause some pain in that region. So I'm going to let you go ahead and sit up. And thank you so much. And so, you know, hip arthritis is extremely common. We see it in a lot of people. If you think you might have hip arthritis, there are a couple things you can do. If it's not too severe, you can try to do some exercises to strengthen the structures around your hip joint. We can't change that ball and socket unless you have it physically changed, like when you have a total hip replacement. But if you increase the strength around the hip, you can sometimes get some better function, better stability, better endurance when you're walking. So if you're interested in some exercises, be sure to check the link above, and I'll have some exercises that are safe for people who have hip arthritis. If you're suspecting you might have hip arthritis, be sure to contact your medical provider, get an x-ray. It's really the best way to identify if it's there and if it exists there. Then you can talk about where to move from there. If you enjoyed today's video, please give us a like, and I hope that you subscribe. Thanks.